Today I'm going to talk about lupus or SLE. What is lupus? Lupus is systemic lupus erythematosus, or known as lupus. What is the meaning of lupus? A chronic inflammatory condition caused by an autoimmune disease. An autoimmune disease occurs when the body tissue are attacked by its own immune system. As you can see from the photo, the antibodies attack its own tissue cell. What are the effects of lupus or SLE? Lupus can cause disease to the skin, heart, lungs, kidney, joints, and nervous system. When only the skin is involved or affected, the condition is called lupus. When the organs such as kidney, lungs, and heart are involved, the condition is called systemic lupus erythematosus. Up to 10% of person with lupus will eventually develop systemic lupus erythematosus. Symptom of lupus: photosensitivity, loss of appetite due to weight loss, butterfly-shaped redness on cheeks, as you can see from the photos. There are butterfly shape on the cheeks. Hair loss, fingernail turns blue, anemia, pleurisy. Pleurisy involves inflammation of the tissue layering the lungs and the inner chest wall. Pericarditis is an inflammation of the lining surrounding the heart. What are the stages of lupus? Actually, there are 5 stages of lupus, beginning with stage 1 to stage 5. During stage 1, there is no symptom of lupus. During stage 2, it is the early stage of lupus. During this stage, patient experience mild symptoms and they can be treated with corticosteroid. Corticosteroids are the class of steroid hormone that are produced in the adrenal cortex of the vertebrates, as well as the synthetic analogs of these hormones. Stage 3 is the early phase of advanced lupus. At this stage, patient needs a lot of corticosteroid. Stage 4 are the advanced phase of lupus, and the patient are at risk of kidney failure. And at stage 5, kidney are losing high amount of protein, and the patient experience a lot of swelling. Most people with lupus reach life expectancy and manage to get condition well with treatment. Treatment of lupus. Treatment of lupus depends on the sign of the symptom. The goal of the treatment is to ease symptom, and for your information, there is no cure for lupus. The medication most commonly used to control lupus include non-steroidal anti-inflammatory drugs, anti-malarial drugs, corticosteroids, and immunosuppressant drugs. Even though these are the medication, there's also side effect of this medicine. For example, non-steroidal anti-inflammatory drugs will cause stomach bleeding, kidney problem, and increase the heart problem. Anti-malarial drugs can cause stomach upset, but it is very rarely and damage to the retina of the eye. Immunosuppressant drugs may increase the risk of infection, liver disease, and decrease fertility and increase of cancer. What are the causes of lupus? The exact causes of lupus isn't known, but several factors have been associated with the disease. Genetics, environment, sex, and hormone. Genetics. The disease isn't linked to certain genes, but people with lupus often have family members with autoimmune condition. Environment. Environmental triggers can include ultraviolet ray, certain medication, viruses, and trauma. Whereas for sex and hormone, systemic lupus erythematosus affects women more than men. Women also experience more severe symptoms during pregnancy and with their menstrual period. Both of these observations may lead to some medical professionals to believe that female hormones estrogen may play a role in causing systemic lupus erythematosus. Ways to prevent lupus. There is no currently a way to prevent lupus, but people who smoke may be more likely to get lupus. Avoiding smoking and perhaps other tobacco products may decrease your risk of getting lupus. Fact about lupus or systemic lupus erythematosus. Systemic lupus erythematosus is 8 times are common in women than men. Lupus Awareness Month is observed during May. According to the Lupus Foundation of America, at least 1.5 million Americans are living with diagnosed lupus, and more people have lupus than AIDS. Systemic lupus erythematosus. You think it's difficult to say, you try living with it. Lastly, I won't take all the credits myself. Half of the credits goes to all YSF committee and also a person who inspired me to do this talk. Do you guys want to know who the person is?
Yes. Yes.
The person who inspired me to do this talk is Norfa binti Zamri.